You are watching McLaren Port Huron today's health program, and I'm speaking with urologist Dr. Haider Rahbar about prostate cancer in this segment. Dr. Rahbar, can you explain to us what is prostate cancer?
So prostate cancer is an abnormal growth within the prostatic gland. And it's a disease that affects men. It's the most common cancer after skin cancer in men. It will affect 1 in 7 men during their lifetime. They will be diagnosed with prostate cancer.
What are some of the symptoms that a man might experience if he has prostate cancer?
Unfortunately, most men are asymptomatic when they present with prostate cancer. That's why screening is an important topic that we have to discuss with men. Usually when symptoms present, the disease has advanced. They can present with some urinary symptoms similar to BPH, such as a weak stream and straining with urination. But when that happens, that means the cancer has overtaken the majority of the prostate. And some men present with back pain or bone pain, and that usually is a bad sign. That indicates that the disease has spread from the prostate to the lymph nodes or to the bones.
And can prostate cancer be prevented?
So there is some theories that the Western diet heavy in saturated fat is contributing to the increased prostate cancer rate in the United States. That's one of the possibilities. But if you have a family history of prostate cancer, you're more likely to have prostate cancer diagnosed.
And you had talked a little bit about screenings. So we know that the PSA blood test is one of the common screenings, but can you tell us a little bit about that?
So the PSA, it's a protein that is produced by the prostate. And the bigger the gland, the more PSA it will generate. So sometimes in bigger gland, we do see a little higher PSA number. Other causes are infection and inflammation. But the thing that we worry about when PSA go up is prostate cancers, because prostate cancers tend to secrete more PSA than normal glands, and that can be a red flag. And we don't just truly look at the PSA number, but we also look at the PSA trend. For example, is it doubling? What's the doubling time and things like that to give us a clue whether there's a possibility of prostate cancer there.
And that test really isn't appropriate for anyone, right? Because you wouldn't start at a younger age, for
Correct.
example.
So, and men younger than 40, we don't recommend them to undergo a PSA testing. For men between age 40 to 55, it depends if they have risk factors, family history of prostate cancers. African American are more likely to get prostate cancer, so the screening might start earlier in those men. Men between age of 55 to 69, the recommendation from the Urological Society is to screen. And once men pass the age of 70, we kind of determine their life expectancy. If we anticipate them to live 10 to 15 more years, then we continue screening during that age period.
And the guidelines have kind of changed, because it used to be a common test that you would see offered at health fairs and things like that, but you had talked a little bit about that, talking about risk factors, so it's more than just offering this test, correct?
Correct. Initially, it was recommended that all men be screened for PSA. Kind of new guidelines came from the United States Task Force, which is basically a branch of the government that gives guidelines, where they initially recommended against screening men, but now it's kind of turned into more of a discussion. That's why we prefer to have a discussion with men to let them know kind of the benefit of screening, the harm of not screening, and then if we screen, what are the risks and all of that. So everybody can make an informed decision about their health.
Yep. And so the PSA isn't the only tool that you use to diagnose. What other types of tests do you perform?
So the other thing we do is a rectal exam, and the reason is to do a rectal exam is it's easier to feel the prostate through the rectum, and then the main thing we're looking at, we're assessing the size of the prostate, but then we're looking for any abnormal growths or mass within the prostate. And if either one comes back abnormal, the rectal exam or the PSA, then the next step would be to do a biopsy of the prostate.
So what are the treatment options for prostate cancer?
So some of the treatment options, it all depends on once the diagnosis is made. Prostate cancer has a wide variety. There's kind of low aggressive, moderate aggressive, and very aggressive. If it's a low risk disease, one of the options is actually just to continue to observe it, because prostate cancer is such a slow growing disease that it might not advance or spread before the person passes away from other causes. So that's one option for men with low risk. But if you have low risk, you have to be willing to continue to surveil it with continued PSA testing, continued rectal exams, and possibly a repeat biopsy every few years or so, just to make sure the disease hasn't progressed. The other options, if for men that are not willing to surveil it, or men with more aggressive disease, is surgery or radiation, are one of the two mainstays treatments out there. And then there's also other treatment options, such as cryosurgery, which basically freezing the prostate. There's something called HIFU, where they use ultrasound frequency to destroy the prostate, and then there's brachytherapy, which you implant basically seeds to. It's type of a radiation to kind of eliminate the disease.
So there's a lot of different courses that a man could take if they find out that they have prostate cancer.
Correct.
So so really it's individual for every person.
Absolutely. I mean, when a person has a diagnosis, we have a long discussion about all the treatment options, and we make sure that they are aware of all their treatment options before we go ahead with the final treatment option they choose.
Yeah. So in some cases it might be radiation before surgery, or it could be different.
It could be. I mean, usually the problem is once the prostate gets radiated, it kind of scars down, so surgery becomes a harder operation, but it has been done. We have done it before. And sometimes we have to do surgery followed by radiation if they have a more aggressive disease. Sometimes we have to use both treatments to control the disease in people with more aggressive cancers.
So let's talk a little bit about the surgical options that are available. And I think we have a diagram here, if you can explain the different options that are available.
Absolutely. So historically, the surgery was done through an open incision, basically below the belly button. And one of the difficulties with that surgery is the prostate sits behind the pubic bone, which is right up here. So the surgery was very difficult, is that you had minimal visualization and you were operating into a much deeper space. And it was associated with a lot more blood loss. People lost about 1 liter of blood during that surgery. They were in the hospital for anywhere from 3 to 7 days, and it involved a longer recovery period. Nowadays, most of the prostate surgeries, or pretty much all of them, are performed robotically. The advantage of the robotic surgery is that you have smaller incisions, so you'll have a smaller incision above your belly button, and then few smaller incisions where the robotic arms go in. And the advantage of it is that you have a high-definition camera that goes through that incision, and then you visualize everything that's going on in the pelvis. And what the robot does is every movement that I make with my arm, the robot copies it. So I'm able to make a delicate surgery because the robot is basically doing all my micro movement. And it's associated with much less blood loss. It's an easier operation than what it used to be. And most people are in the hospital for 1 day versus what they used to be before that.
I believe in our other graph that we have up, you can show what it would look like when you actually remove the prostate or do a prostatectomy, right?
Okay.
Yeah.
So when we do the prostate, the goal is so you have your bladder right up here, and then you have the urethra, the tube where the urine comes out from. So the prostate sits right up here. So when we do the surgery, we first get to the prostate. Once we get to the prostate, the goal is to remove the prostate, and what will happen is that now the bladder and the urethra are disconnected. And what we do is basically we stitch them back together once the prostate is removed. And when we do the surgery, we're removing the prostate, and the other thing we're removing is the seminal vesicles, because there's possibility of cancer that can spread from the prostate to the seminal vesicles. And in some men, we're also going to sample the lymph nodes to ensure that they don't have disease outside the prostate.
So because the robotic surgery is a little less invasive, and you can just see how treatments have advanced. So the curative rate for someone with prostate cancer, has that improved as well?
So in terms of, a lot of the studies have shown in terms of the open versus the robotic, the cure rate is similar in terms, but it's the big advantage of robotics is recovery time and the blood loss. There's less risk of getting a blood transfusion. There's faster recovery. Men are able to leave the hospital the following day. And they have the catheter in for about a week, and usually we kind of tell them to limit their activity for about a week, and then no heavy lifting or straining for 4 weeks to make sure your incision heal up. But most men are able to move around and get up the same night of the surgery. I mean, we encourage people to get up the same night of surgery to move around, and most of our patients are doing that.
That's great. This is really great information. We do need to take another short break, but we will continue our discussion when we return.